Hi, Rod Rohrich, Rohrich Knows Podcast. Welcome back to this amazing series on skincare, helping you become a better you. And, you know, there's always a reason and a season to do something to look better and feel better about yourself. So I've invited Dr. Clifton, Missy Clifton, who's got this amazing practice, Premier Dermatology in Bentonville, Arkansas, to share with us her 3 top procedures for every season and the reason why these help you become the best you can be. So, Missy, welcome. I mean, of course, they all want to look like you. So how do they do it in every season? So, okay, summer's coming up. So what are the top 3 things that you tell your patients they can do? Obviously, they want them all done and they don't want any downtime. So what do you recommend for the summer?
So for people who are kind of preparing for the summer, trying to kind of get rid of some of the dead skin, maybe that they've accumulated over the winter from all of the dryness, I love to do things like hydrofacial or diamond glow, because when they come in, you're just getting rid of some of the dead skin. You're exfoliating, you're really hydrating, and really preparing your skin and getting your skin nice and healthy for the summer. If people tend to have some melasma or some hyperpigmentation, it's great to really get that under control before the summer, because as we know, even when we try really, really hard with our sunscreens and hats, those conditions can get worse in the summer. So if we can get them under the best control, that's great. I love microneedling for that. I also love very mild chemical peels to try to eliminate some of that hyperpigmentation as well. So those are really those kind of summer preparation procedures that I really love.
And there's hardly any downtime. I love hydrofacials. I mean, I love
getting them.
It's just very, very soothing. And it feels good too. And there's some great effects to that. And there's minimal to no downtime for any of those, right? What you just said.
Really almost no downtime. Even with microneedling, you may have a little redness the first day or so, but it's very, very minimal.
Good. And of course, always sunscreen. Always sunscreen. So let's talk about the fall, okay? Because it goes like that. I mean, we all love the summers in the South. I mean, I love the heat. I'm not a cold weather person, but so it's getting a little. The leaves are turning. So what do you tell your patients? What are the top 2 or 3 things they should do or consider?
Well, so we call it summer cleanup. The fall is repairing the sins of your summer. So when you come in, most of us in Arkansas are out on the lake and, out in the sun a lot. I'm sure where you are too.
Yes.
Lots of sun damage happening over the summer. So we tell people, let's get you in and let's really assess what's happening. The fall, most people are still very tan, unfortunately, even though they're supposed to be wearing their sunscreen and protection. A lot of them are tan. So certain procedures are not safe on tan skin, like BBL, or broadband light or IPL, those treatments that are, great for removing redness and brown. We can't really use those in the summer and fall. So a lot of it is trying to see, are we getting rid of some of your sun damage? If so, we might want to step it up to a little bit more of a more powerful laser resurfacing like Laze MD or very light erbium resurfacing. Maybe we want to just tighten up the skin because we know we've done a little sun damage. Maybe we want to do some microneedling if we've got some acne scars or things that, from the hot summer months, we had a little flare of acne potentially. Maybe we want to try to minimize that. Or again, maybe your skin's just really dehydrated. Maybe you just need some really good facials, to exfoliate and hydrate. So I like microneedling, sometimes radiofrequency microneedling, mild resurfacings, maybe a little bit of a mild chemical peel. Yeah, those are the main ones, and maybe something like hydrofacial or diamond glow just to exfoliate and hydrate the skin in preparation for the winter.
And then maybe adding some moisturizers, right, at the same time with your skincare, yeah.
Homework is always key, really getting you on some of the, the good topicals to really reverse and rejuvenate the skin, getting you on a retinol, getting you on a good exfoliator, maybe, some antioxidants to really reverse some of the damage that you did.
Okay. All right. So we're getting into winter now. It gets relatively cold in Texas and Arkansas, but for us, it's cold.
For me, it's way too cold. Again,
Same here.
My end game is to find a beach somewhere, I think.
Same here. Same here. I'm with you. I'm with you. I'm doing it. So
winter is the time where we can get a little more aggressive. A lot of my patients that have, active rosacea and a lot of redness and telangiectasias or dilated blood vessels, this is a great time to do it because you're not tan, your skin's as fair as it's probably going to be. So a series of broadband light or IPL, we'd love to do that because it gets rid of a lot of the red, a lot of sometimes the brown discoloration as well, not necessarily melasma, but more just sun damage. And it's great for just collagen stimulation and tightening. And then just to reverse a lot of the chronic sun damage that a lot of people have over the years, I like to do the deeper resurfacings with erbium and some of those in the winter because most people are able to hide out a little bit more. They're able to protect themselves from the sun. They're not going to be exposed at all. So those are great options in the winter. And then of course, everybody, in the winter in Arkansas has drier skin.
Right.
So we may be needing to talk about, what is our skincare regimen? Do we need to be doing some hydrating facials and things like that to really boost your skin hydration and help with gentle exfoliation and really optimizing your homework to keep your skin moisturized and healthy.
Right. So the winter's kind of to replenish, and you can do things that are a little deeper too, because you'll have more downtime and then not be in the sun. So, okay, and then in the spring, you're ready. You're gonna hopefully get back into it, right?
Yeah. So I would say the spring is probably the time when people are really doing more for body than they are maybe for face and neck. A lot of my patients in the spring are like, oh my God, there's bikini around the corner. And they're freaking out. So they're wanting to do some treatments like True Body or maybe some cool sculpting or maybe some radio frequency microneedling on their tummy or thighs to kind of tighten up the skin. Maybe a little bit of liposuction, here and there if they have a lot of, just areas that are not going to go with diet and exercise. Right. So there's a lot more focus on the body in the spring. Of course, the face, we're always talking about, we get some nice days even early in the spring in Arkansas. So we're talking sunscreen, we're talking prevention with skincare and all of that as well.
Yep. No, I agree. It's the full circle. I mean, really it is. And I think that's why it's not only it's integrated, but it's maintenance of care. And I think that's why you just can't do a spot treatment of anything. It's like anything else when you want to keep looking and being your best, you just can't do it once or twice a year. It's kind of a continuous motion throughout the year.
Yeah, that's why I tell my patients we have an open house in the spring and we have an open house in the fall. And I tell my patients when they're coming in to see me, we're here to make a treatment plan because we're not gonna stop the aging process, but we're darn well gonna fight it with the gloves off. So we got to make a plan for how to do it. And that's you working at home and us working here in the office together.
Yep. No, that's great. And the amazing thing is, Missy, you as a dermatologist really have done that so well. Plastic surgeons, we kind of do episodic. And, I've learned that I now no longer do it episodic. I mean, sure, I'll do the facelift, I'll do the rhinoplasty, the body contouring, but we always keep integrating because if you want to make it look good, you've got to also do all these other things, skin care, skin tightening, because, we all live on planet Earth. So, we always have the effects of gravity. Nothing changes. So it's great.
Well, we all learn from each other, and it takes a village, my friend. So I send a lot of people to the plastic surgeons as well. So you guys we have to work hand in hand to fight the whole thing.
Absolutely. Wise words from Dr. Missy Clifton in Bentonville, Arkansas. Phenomenal. All right, helping you become a better you, and then give us your thoughts and comments. Until next time, enjoy.